You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the aging eye. What can be done in and around the eyes, both non-surgically and surgically, to make you look years younger and look rested and refreshed? With us, we have Manhattan cosmetic surgeon, Dr. Basil Pakeman. Dr. Pakeman, welcome to the program.
Thank you. Pleasure being here.
Now, before we get into today's topic, I know you brought some photos. You have special training as an ophthalmologist.
Yes.
And you have kind of restricted your practice to in and around the eyes. Is that right? So
Yes.
for people that don't know you or your practice, who's a typical patient that's coming in for eye beautification?
I have a wide range of patients that are coming in. I have patients as young as in their 20s, as old as in their 80s. It is a broad spectrum. But the vast majority of patients, I can say they're all coming because they need something or they want to look better. You know, there's something around their eyes they're not happy with it. They want to improve it. For instance, let's take, the crepey skin around the eyes as an example.
Like crepey little wrinkles?
Wrinkle eyes,
around the eyes, okay.
or bulging fats around the eyes. They don't like the way they look. Bottom line, they're looking, a lot older than what they are, which can be fixed. It can be fixed surgically or non-surgically in some cases, depending on what the situation is.
Now, you believe, and you told me in the green room, you said that you love taking care of eyes, under the eye, above the eye, because it's the biggest bang for the buck in all cosmetic surgery. You believe that?
Absolutely. I love working around the eyes. I love doing cosmetic surgery around the eyes. I've been doing it for the last 23 years. Yeah, I love it. I enjoy it. It is my passion.
What advantage do you have, do you think, when treating in and around the eyes?
Well, I have training in terms of looking for aesthetic beauty, but not only that, I also have a sense of the function of the eyes too. So it leads to a nice balance to deal with these people's problems. Because it's not only getting someone to look beautiful. After getting to look beautiful, you want to make sure that the eyelids function properly.
Okay.
It's very important. Oftentimes, you may see someone get eyelid surgery, for example, a blepharoplasty. And a blepharoplasty is an eyelid surgery. It's a cosmetic procedure. And sometimes they come back not being able to close their eyes. That's not a good situation to be in. Having to take artificial tears, which can lead to even further problems. Cornea decompensation affecting the vision. No one wants to be in that situation. So you have to balance beauty and function.
Okay.
And as an ophthalmologist, we do that.
All right. Now, you do more than just eye surgeries. I mean, you do facelifts.
Yes, I do. Oftentimes, someone comes in for blepharoplasty, eye lift surgery, and they may have other issues going on. They may have jowling, sagging necklines. These things need to be addressed, and sometimes we may do a neck lift or a facelift along with a blepharoplasty, and it leads to a beautiful, wonderful surgery. And person's a lot younger, and most important thing, they feel a lot better. It gives them confidence to go back into the world. It's a nice thing.
Are there a lot of people, by the way, 'cause, I mean, you're in a unique situation. Women come to you, men and women, let's say more women maybe, and they tell you their problems, their insecurities,
Yes.
as far as their appearance. So on these consults, what do women say they want?
Well, it's funny you mentioned that. You mentioned men and women coming to me. Well, guess what? Yeah, there are more women coming to me, but surprisingly, there are a lot more men coming for cosmetic surgeries too.
Okay.
But typical women, they're coming in, and most women nowadays days they're active, they're exercising, they're conscious of their diet, and they feel well. But they look in the mirror, and there's a disconnect from what they see and what they're feeling. They don't like that. They say, guess what? I feel wonderful, but the way I'm looking, I don't like it. I'm beginning to look like my mom. It's just not what I want. I never picture I'll ever be in this situation. Again, somebody come in and say, guess what? I just don't feel attractive anymore. I want to look attractive for my spouse. And these are issues that are brought up. And someone may come in and say, guess what? I just don't like the crepey skin around my eyes. I don't like the wrinkling on my lower lids. I don't like the bags that they're seeing. They don't like the folds coming down from around their nose and nasal label, lines that are coming down. And they just don't feel happy. And they give the parents that, looking like they're mad when they're not mad. The complaints are multiple and different, but the one thing that's consistent throughout the whole situation is that they're not happy with themselves. They want a fix. Let me give you an example. I had a woman come in with her husband, and she came with puffy eyelids on the upper, on the lower lid. The neckline was all saggy with jowling. With her, here's what we did. We got rid of the excess skin, the herniating fat, the bulges of fat was there. Made the areas nice and smooth, nice transition from her eyelids into her cheek. Very nice lines. Her neckline, again, nice and smooth, right in her jaw lines, nicely chiseled in. All these lines here, nasal labia, they were pulled nicely up.
Okay.
She looked fantastic. Her husband saw her after the surgery. He could not believe it. His kind of, oh my God, wow, you look 10 years younger. And each time she sees me, she can't keep on thanking me for the results that she's gotten.
Now, women, they don't want to look done, right? I mean, is that their fear? Like, I don't want to look done?
No one looks
that?
done. Basically, what people want, they want to look like a younger, healthier version of themselves. They don't want to look surgerized at all.
Okay.
They want to look refreshed. Well, the greatest thing about this, the transformation for these people can be quite expensive afterward. Because
expensive?
Yes. Well, guess what? They want to go out and buy new clothing.
Okay.
They want to look their best.
All right.
Their face is looking the best. And guess what? You can't hide your face from the world. It's out there for the world to see. It's unlike a tummy tuck. It's hidden. This the world sees. And why not complement it with nice clothing too?
Okay, good. Now you're the eye guy, the eye beautification guy. At least that's what I'm calling you, right? But that's what you do. That's your space.
Yes.
There in Manhattan. Do people travel to see you?
I have patients from all over the world. I have patients nationally, internationally, locally. I have patients who are the regular moms at home, to execs, people who are in the performing arts, singers, actors. There's a broad spectrum of patients. And as I said, the one thing they all have in common, they all want to look their best. And we do provide that for them.
Natural results.
Natural results.
Okay, so
it's about always looking natural, never looking like you had something done.
Which, this is a sidetrack, but when you see somebody that looks pulled or tight or done, is that in the hand? I mean, who wanted that? Was that the surgeon's idea of what looks good, or do you think it was the patient, that's what they wanted? Or a combination of both?
I don't know whose idea it is. Could be both in a way, but guess what? Realistically, I know for one thing, the public doesn't like it. They comment on it. We see it on YouTube. We see these things.
Housewives shows internet. Like in Orange County.
Yeah, and we all make comments on it because it doesn't look good. It doesn't look right. When somebody's done rightly, you will never know that they got done, and that's the point. You never want anyone to know that you had surgery. You just want to look wonderful and great.
Because you specialize or focus on the eyes. How important are the eyes to you? As far as looking good,
not to
looking
me.
young.
In general, the eye is the most important part of the face. It's the first thing that's noticed. It's the area that ages the fastest and ages first. And so therefore, when you meet someone, the first thing that you notice are their eyes. The eyes tells a story in itself. You can tell if someone is sad, happy. There's emotions in the eyes. There's a look in the eyes.
You told me this on the telephone about the eyes that when you look at somebody, you're trying to figure out I wonder how old they are. You tend to look at their eyes. That's like the dead giveaway.
The eyes, one of the
that's what you told me, and you're right.
That's true. The eyes is one important place you can look at, but don't forget the neckline. Don't forget the hands too.
Okay.
These are areas where the skin is a little bit thinner, but around the eyes has the thinnest skin of all the body parts.
Is that
so
right?
therefore, it shows age fastest.
Let's talk then about both surgical and non-surgical above the eyes. This hooding or the brows. Let's start there and then we'll go from the top and then we'll go under the eyes. So what are you doing for above the eyes?
Above the eyes, the most important thing is the skin that we see up there. You get that scrapey looking skin, excess skin that's hanging over, just drooping over. So what do we do about the sagging skin? Let's start with the most benign thing that we all know about. We all know about Botox, don't we?
Okay,
well,
some of us.
The world knows about Botox.
We all know, okay.
Yeah. Anyway, the most common things, we can treat the little lines around the eyes, the crow's feet area, but sometimes you can even use Botox to lift the brow, a fallen brow. Botox is a wonderful treatment there. Let's move on from Botox. Let's look at other options we have. They're non-surgical still.
Okay.
We can use some ultrasound treatment. Another option that we have available is Altera, which is ultrasound treatment for the hooding around the eyes or even lifting the brow.
So it's non-surgical.
It's non-surgical. It's a wonderful treatment. What it does is ultrasound, so it heats up the collagen and elastin fibers. So it contracts the tissue and lifts the brow or lift the tissues in general.
Nice.
And it's not painful. The older type of Altera was painful. The newer version is not. But again, this is not for everybody at all, but it's a good first step in for early intervention.
Of the sagging of the skin.
Of the sagging skin, yes.
Okay.
And we have other options. Let's look at fractional laser that we can use. Again, with fractional laser, there may be a little downtime. And what fractional laser is just using pinpoint laser points to treat the skin instead of the old-fashioned CO2 laser where we just literally went over the whole skin and destroyed the whole skin surface with prolonged healing time and redness that lasted for weeks. With fractional treatment, is you can adjust your downtime to a couple of days. But again, it is still a little bit of surgery in a way. And ultimately, some people just need surgery. You can't avoid it. Surgery is a definitive step. It's a definitive step. And surgery in upper eyelids, is referred to an eyelid or a blepharoplasty, as most people would know it as.
Blepharoplasty.
Yes.
Okay.
And that, you can just go, remove the skin, and that can move multiple ways. Some of us may use a laser to do it. Some of us may actually use radio frequency, and some of us just may use a cold steel as usual to remove it. But guess what? They all work pretty well. I personally like to use radio frequency. And the reason why I like to use radio frequency...
In combination with a surgical procedure?
Well, radio frequency as a cutting means.
Oh, as a cutting means.
As a cutting means.
Okay.
Instead of using a blade, you use radio frequency as a cutting means. And the reason why I like to do that, it causes minimum to no bleeding. And therefore, it makes your healing faster. A much faster recovery time.
Now you say over the eyes, that blepharoplasty
Yes.
is a technically demanding surgical procedure. To get it right.
Conceptually, it is an easy surgery. Technically,
Okay.
it is a difficult surgery to do. As we're doing blepharoplasty, we have to take into consideration the skin, the muscle, the fat. Not only that, there are different layers of muscle that we have to deal with. So therefore, we have to be very delicate in this area. Therefore, if we take too much, too much skin, which we see a lot of time, is not a good situation to be in or to put a patient in.
Why doesn't it look good if you take too much
We
skin?
never want to take too much skin. We never want to take too much fat. We never want to take too much muscle. Let's take fat for example. If we take too much fat, what we do, we just basically create a hollow area. And these patients may look wonderful after surgery, but look at them 3-4 months down the road, or even 6 months. They look like skeletons. They're skeletonized. They're hollow.
It makes them look older, by the way.
Makes them look older. And that's not the reason why they went for surgery in the first place.
Interesting.
They went to look younger, not to look older. You just basically took, a 50-year-old and made him a hot mess.
Okay.
That's not what they wanted. So that's the reason why it's technically difficult.
Artistic. Is there more art than science on this one? Like you have to have good judgment?
This is
it sounds
art,
like an
this is
honest one.
science, this is craftsmanship. all mixed in together. And you have to find the right balance. Here I like to do, I like to individualize my surgeries based on what's going on with an individual. Some individual needs fat to be taken out, some do not need fat to be taken out. So it's a surgery that's really individualized. Let's say, just take out the right amount of skin so they can close their eyes properly. And when they do open their eyes, you see a nice curved arch, enough so they can actually put on their eyeliner, their eyeshadow, and look exceptionally beautiful. And the brow is important, especially the lateral brow. If you look at a female, the lateral brow, the lateral third of the brow is nicely arched. It's thin, a lot more thinner than the head of the brow. So you want to maintain that curvature and arch, and you want to maintain it above the bony orbit of the eye. So you also want to make sure that when you're doing your blepharoplasty, that you maintain it and you stabilize it in that area. And there's a special technique that I use to make sure that it's out there.
Is it a secret technique?
It's not a secret technique. It's not a secret technique at all. It's
Okay.
called browpexy.
Okay.
Most doctors know it, but you gotta make adjustments for that within your surgery and know when to use and when not to use it. Just by removing just the right amount of skin and fat, they can look so fresh, so bright, and much younger. And the most important part about this, when this is all done, I see these people, they're so confident. They're back to their youthful glow. That's what's important about this, feeling good about yourself. Another population that I like to see more often are the Asian population. We've been doing quite a few of these Asian lids. Basically, what's important in Asian is having an eyelid crease. Going from a single eyelid crease going to a double eyelid crease. It's not taking an Asian woman and make her a Western woman at all. It's to create an eyelid crease. And by creating a proper eyelid crease, what you're really doing for an Asian woman, you're making the eyes look larger, not westernizing them at all.
Okay.
And if you look at an Asian lid, the eyelid crease, they may be absent, or the eyelid crease may be partial or incomplete. And we just want to make sure they have a nice arch throughout the whole eyelid. This is not for everybody at all, but if you don't like your eyes, do something about it. Because we can do something. And I've done many of these surgeries, and I see the difference it makes in these individuals. They're very happy.
Now, I know you brought photos. We're going to get to those photos. Very dramatic, by the way.
Yes.
Under the eye, what are the different categories of problems you see in your office?
Oh, we see these patients coming under eyes, all looking puffy, dark appearance, hollowness, making look aged. The problems they're limitless on under eyes. But the thing that usually gets my attention was having the crepey looking skin under eyes. And we can address it.
So the little wrinkles that are just...
We see little wrinkles to large wrinkles under eyes.
All right. So they come in and they tell you that. So what do you do?
Well, let's start out with the simplest thing that can be done. There are fillers. There's Botox. And usually a little Botox helps to get rid of some of the fine lines, especially if the crow's feet areas in this area. Fillers are great, especially if you have hollows in that area. The tear trough hollows, we fill with a little filler, give you a nice smooth transition. The eyelid rolls right into the cheek nicely, gives you a much younger look. It's wonderful.
All right.
There are more aggressive things in that area. Let's say, for instance, you have these herniating fat pads, these bags on there, but the skin is nice. We can do surgery. And it doesn't have to be on the skin. It could be done nicely inside the eyelids. Sutureless, scarless surgery, where you just make an incision right behind the eyelids and just remove the fat. No one have to know that you ever had surgery.
So they have those bulging bags.
Got taken care of. They're gone.
Okay.
Never to come back.
Now back to, though, under the eyes. I know you could do lasers and fillers and Botox, but what if it's really bad? What can you do?
Well, if we had someone had really crepey skin under their eyes, we just make a nice little incision right under the eyelash line, nicely hidden. No one ever know we ever had an incision there. We just lift the skin, lift the muscle layer very gently, and we pull up the muscle layer and the skin, smooth it out nicely. And if we need to take out fat at that time, we can take it out at the same time and just tack it right back up nicely. I can take someone with all these wrinkled under eyes and smooth them out and make them look really rejuvenated and it look like they're ready for a night out on the town.
Okay.
They're ready for a cocktail party.
And you can't really tell. I mean, you can't identify that. It doesn't change the shape of the eye or anything like that.
That's where skill comes in. In that area, you can change the shape of the eye if it's not done properly.
Okay.
And that's one of the major complications of this surgery. When done properly, you won't have that. And that's the whole trick behind this. It's tightening the muscle.
Now, under the eyes, fillers, but you say, using their own fat and putting that under their eyes.
Yeah, I love using fat on the eyes. It is a wonderful technique. What it does, it really rejuvenates the skin around the area. Not only does it act as a filler, it just rejuvenates the skin. It changes the texture. All of a sudden, they start having baby smooth skin around the eyes.
Really?
It's amazing. You know what they say about fat? It has stem cells in it.
Okay.
And I think that's probably the reason why this area changes so much. But
So
it
using
really makes,
their own fat.
it really makes a difference.
And what do you call it? You call it,
It's just called a fat grafting or a fat transfer.
all right.
But it's been around for years, and it's being used a lot more now. And besides that, it's a lot more longer lasting.
Now, men, are they especially afraid? Because like if I do something someday, I don't want to look feminine or like I want to look, natural.
Well, that's important, especially men. You can feminize a man very easily by doing the wrong type of surgery.
Okay.
Let's say you were doing a blepharoplasty and you happen to lift the eyebrow and you happen to lift them too high, or if you happen to lift them arch, you take a man and make him a female by doing that. A male's brow is flat and it's at the level of the bone. A female's different. It's above the bony and it's arched, especially in the lateral areas. It's important that we make the difference between male and female.
All right.
Let's take this gentleman here. Randy, this is typical, and this happened in both males and females, where we have this, the fat coming forward, the fat bags, the overlying skin. It makes them look, tired. It doesn't look nice. So guess what I did? I cleared it all up, got rid of the fat, tightened the skin.
Wow.
And wow, what do you see? Most important, you see his nice blue eyes.
It's fresh.
He looks a lot younger and refreshed. He doesn't look like he had surgery. He just looked like a younger man.
And for the lower, what'd you do? You filled it in with fat? Or
No, this gentleman, no. I took out fat in his situation.
Okay.
You have to know when to take out fat and when to add fat. That's the trick, too. If I had added fat, oh my God, that would have been a disaster. No, he needed fat out.
you think, and we are short of time, but there's a lot of people that are being overfilled, using too much fillers.
Absolutely. Doesn't look nice at all. You make their eyes look small by adding too much fat. Their cheeks become too huge. It doesn't look nice. And it's very obvious.
Yeah, that's true.
We want someone to look natural, rejuvenated, not, someone ready for a show. Let me show a female here.
And these are subtle. Like we're talking about bags
This
under
is
the
a
eyes.
beautiful young lady.
Or hollows under the eyes.
Yes. And she's only in her early 20s. Sometimes this is not about aging. It's about genetics. There's some people that have these deep hollows. They're maybe in their late teens, and they're there. And that was her situation. She had it all her life. She wasn't happy with it. She had used fillers in the past. She said they went away too fast. She wanted something that lasted longer. And I gave her a couple of options. She chose fat. So we did fat. And look at the after. She looks wonderful.
You can't tell.
It's a nice transition from her eyelids into her cheek. It's nice and smooth. And this is not, we see this in our 20-year-old, but guess what? This is more typical in our 40-year-old. Again, with aging, we see that changes where it gets hollow, and the same result we see in our 40-year-olds that we see in a younger person. It's a wonderful result. And guess what? It lasts longer, and especially when we're in 40, guess what? Our texture of skin actually changes. So what else is better?
The texture of the skin changes.
Yes. What else is better to rejuvenate the skin again? Fat.
So you add their own fat there.
Yes. And it makes such a big difference. So you're really getting a double punch here. You're getting the filling in there in the area, but you're getting the textural changes that are occurring in the area.
Final message to a woman watching this or a man, they don't like the way they're aging, but maybe they're afraid of looking done. What's the first move? What do you say to them?
Come on in. First of all, find out what your option is. We have, quite a few options, from the non-surgical to the surgical. But the most important thing is that you want to go to someone that has a broad variety of options available to you. We do. It's not one solution for everybody at all.
That's a good point, because there's a lot of medical spas that they don't do surgical. So you're only going to be offered potentially just the fillers.
That's true.
Is that right?
That's true. And that's
where you do both.
We do both. I do both.
Are there people that think they need surgery and you have to talk them out of it and say you just need something else?
That happens. It happens. And that's the reason you got to come on in and we can sit down, we can talk and figure out what's really best for you, the individual.
All right, great. And it is a free consultation?
It's a free consultation.
Okay, good.
It's advice.
All right, I want to thank you for coming on the show.
Thank you. Appreciate it.
Good job. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.